Now, reinforcements could be brought into the front line of the New South Wales COVID response as the state faces a challenging fortnight. Authorities are preparing for a surge in COVID cases, with hospital admissions likely to peak in October. A group of Sydney firefighters and paramedics remain on standby as a workforce plan is being reviewed. Graduates could be accelerated into the workforce and annual leave cancellations could be implemented. Fire and Rescue New South Wales says it is prepared to provide assistance. October expected to be the most challenging month for hospitalisation, but residents are being encouraged to focus on the high rates of vaccination.
It's the state's deadliest day of the pandemic. 12 people, including an unvaccinated woman in her 30s, have died with COVID-19. But residents are being warned the worst is yet to come.
So the next fortnight is likely to be our worst in terms of the number of cases.
Cases in the regions are growing. 53 infections have been recorded in Western New South Wales, 7 of which were reported in the far west town of Wilcannia, where around 10% of the population is COVID positive.
Been working with the community. We've got the local health service, of course, we've got the community on side.
There are almost 1,000 COVID patients in hospital. 160 are in intensive care, 75% of whom have not been vaccinated. 63 people require ventilation.
The highest number of people in our intensive care wards are likely to present during the month of October.
The extended lockdown is taking a toll on children. Parents and guardians are being advised to have a conversation with them about how they're feeling.
But to do so in a way which is non-judgmental. It's important to be validating, to be optimistic, to be reassuring, and to be encouraging of what's going to happen for the future.
Restrictions for fully vaccinated residents are expected to ease in the middle of October, when it's predicted 70% of adults will have had both doses. But in order for the state to continue living with the virus, authorities are flagging a vaccine top-up.
So once a year we're all going to have to go and get our shot, but obviously it'll be a normalised process. Most people will get it from their workplace or through GPs.
Gabriella Power, Sky News, Sydney.